Welcome to the ResearchWorks podcast, broadcasting live from the Oceania Academy of Cerebral Palsy and Other Childhood Onset Disabilities Conference 2026 in the beautiful city of Hobart, Australia. Join Dr. Dana Poole and the ResearchWorks team as we bring you an exclusive series of interviews with visionary keynote speakers and leading presenters, captured right here amid the groundbreaking discussions and innovations shaping the future of disability research and care.
Hello everyone, we are now in the final throes of this conference. It is time to pack up and we can see everyone packing up around us, making a whole lot of noise. Marissa, how are we doing here?
We're good. Our booth is still intact. We have walls.
We have walls, but we're watching around us as everything is being dismantled and people are just throwing things on the ground and there's a lot of noise. But producer Ed is pretty incredible. And he's going to do the best he can, I know, but his fingers are crossed to provide you the best listening experience possible. So thank you so much to everyone who's been listening to this conference series. We've been loving it. We are just feeling like our brains have expanded and we've got so many ideas. We're so inspired. And the next person we're going to speak with is going to teach us a whole lot about an area that we know very little about. And looking forward to a bit of a masterclass here. Joline Brandenburg, welcome to the podcast.
Thank you for having me.
Oh, it's so lovely to have you. We connected mainly because of the connection with AACPDM and what you are part of and what you're about to do. Tell everyone a little bit about that. I think that's kind of cool.
Sweet.
Yeah.
So I am currently the second vice president of the American Academy of Cerebral Palsy and Developmental Medicine. So I currently oversee the committee work, but I'm in preparation for planning and running the annual meeting for 2027.
Wow.
And so that's where we got connected.
Yes, it's so wonderful. And I love that it is these meetings that get us to connect, isn't it? It's
Absolutely.
really, really wonderful. And when I heard that you were coming all the way to Hobart, we had to connect in person for sure. And just a little bit about you, I suppose, because the presentation that you presented here at the conference is titled Developmental Neuromotor Disorders Have Altered Motor Neuron Morphology and Survival. Out of our comfort zone, definitely, but loving the learning that we're going to have.
Yep.
What brought you to this, Joline? Tell us the story.
So getting into this, I'm actually a pediatric rehab physician. I work at Mayo Clinic in Rochester, Minnesota. And most of my background has been completely clinical.
Right.
But coming on to staff, I wanted to do some research and I was very interested in spasticity, looking at how that impacts muscle in kids with cerebral palsy. And it was at a time where I had just adopted a little girl who had cerebral palsy. And so was also a person having to make a lot of decisions about treatments and interventions for her.
Right.
And there was a lot I knew that we didn't know about the interventions that we were doing. And decided I wanted to be a person who was helping in trying to unravel some of those mysteries. So that's the short version of it,
Yes.
which eventually got me into doing some ultrasound work, looking at muscle in people, but it still didn't get me to the question of what does spasticity or movement disorders and that early onset do to muscle, and is there something else going on that's really impacting that muscle?
Yeah.
And so I got connected with some physiologists, some biomechanics people.
Yes.
That word is a little long for me, apparently, despite the title. And so in that connection, they started asking me really hard questions about cerebral palsy, like, why do you guys not talk about the spinal cord?
Right.
So we talk a lot about the brain, we talk a lot about the muscle, but there's that thing kind of in between the brain and the muscle, that's spinal cord. Yeah. And that's also undergoing some developmental changes.
Right.
And so I was really struck by that because I hadn't really thought about it.
Right.
And one of the most important cells that we think about, or at least from my perspective, is something called the motor neuron.
Yes.
And so the motor neuron is the cell that tells the muscle essentially what to do. The brain talks to the motor neuron sends that signal down to the muscle, and then the muscle contracts, hopefully. And so what we wanted to look at was to see, is there something different in the development of that motor neuron, whether it be the number of motor neurons, the growth or size of those motor neurons, and how effective those motor neurons are in actually talking to the muscle.
Wow.
You can't do that very well in humans because some of that does involve actually taking that spinal cord out and really investigating that through other mechanisms. And so we ended up finding a mouse that has a genetic difference that gives it early onset spasticity. So by about 2 weeks of age, it's pretty easy to see that the mice in my colony that have this genetic mutation are much smaller than the other mice. They have a difference in their gait and their movement, and they have these muscle spasms that make them distinctly different than their litter mates. And then we also do genetic testing just to confirm that, yes, indeed, they have that mutation. And so those are the mice that we're taking a look at to see what's going on at the level of that motor neuron, and then also looking at the relationship of that to the muscle.
It's incredible.
That was a great story.
Yeah.
Wasn't it? Just from clinician, that was a wonderful story. I was captivated amongst the tape that's happening on the background there. Sorry, listeners, but believe me, Ed's eyes are darting all over the place at the moment. So you've come from clinician and then you just kept asking the questions and it brought you all the way through to mice and having to look at what the characteristics are there. That is absolutely incredible.
It was a bit of an interesting journey. And I would say the institution that I'm at is probably what makes that possible. Because it's a smaller institution, there's a lot of connections there. And I have connections both in the pediatric and adult world where I work. And so have a lot of resources there that I can leverage and people that are very willing to introduce me to other people to help me try and find a way to answer those questions that I have, even if I don't exactly know the question I'm trying to ask.
How many times do you go to those things where you meet the person, you know you want to ask them something, but to construct that question is quite difficult still, isn't it?
Exactly, especially when you're the one who's like, I'm not entirely sure how to ask this. Here's where I want to get to.
Yes.
How do I get there?
And that's the joy of working collaboratively with people and having these great conversations that what we're having at a conference is, what is it that we're actually looking at? So give us some detail now about what you actually did in this study itself.
Sure. So in this study, I took a look at spastic mice and then mice that did not have this particular genetic mutation. And we looked at phrenic motor neurons. So phrenic motor neurons are those motor neurons that innervate the diaphragm. Particularly interested in sort of breathing and swallowing because, you can't survive without that. And actually, one of the leading causes of death for individuals with cerebral palsy is respiratory disorders, particularly pneumonia. And so there's likely something going on at the level of both the diaphragm and the phrenic motor neuron that are impacting coordination for breathing and also perhaps an effective cough to be able to clear those airways to reduce the risk of having recurrent pneumonias. And so in these mice, we looked at them at different ages. So around P21 when they were just before weaning, P28 is a little bit after weaning, so they were 28 days of age. And then we looked at them when they were more mature, so around 3 to 6 months of age. And across those time points, we were able to see that there was indeed a difference in the number of phrenic motor neurons. My spastic mice had significantly reduced number of phrenic motor neurons. That really started very early on. And they continued to have a reduction even into maturity. And then when we looked at how well are those motor neurons growing, so when we are in that embryonic stage, we actually have more motor neurons than we actually need. And those get eventually pruned by what are effective or what are being used. So that by the time we hit maturity, we have our set number of motor neurons that are ideal. Each motor neuron has a certain number of muscle fibers that it's innervating. And small motor neurons tend to innervate muscle fibers that do sort of this endurance activities, where large motor neurons innervate those muscle fibers that are like your high force, weightlifting type muscle fibers. And so in our mice, we were able to show that the motor neurons didn't seem to either grow as well, meaning that their somal surface area of the motor neurons were smaller. And while they did start to grow between P21 and P28, that growth really plateaued pretty early. And by maturity, there was a significant difference in those sizes of those motor neurons, with the motor neurons that are innervating those really high force muscle fibers being much smaller. And so what does all of that really mean? What's the significance of that? So if you have fewer motor neurons that are innervating essentially the same number of muscle fibers, those motor neurons are having to make more branches to those muscle fibers.
Yep.
And they're having more muscle fibers that they have to innervate. When you have to innervate more muscle fibers, you really can't finesse the force that you're doing. You're either sort of on or off, and you may
Right.
not be as effective in turning on because you have more branches for that signal to get through.
See.
So that could be part of some of the things like glitches in ways individuals move with CP, where they have falls or their muscles suddenly turn off or they can't finesse their activities really well. In breathing, part of this may be that it's harder to generate those high force behaviors. So harder to get
Yes.
that cough for clearance.
Yes.
Maybe harder to coordinate how the diaphragm's functioning for that breathing, sucking, swallowing activities.
Wow.
I'm so amazed by all of this. And I don't just wanted to ask if you looked at this in the study. You might not have been able to, because I have never obviously done any investigations in this area or with mice. But is there any way of looking at the severity of spasticity in the way they physically present? Obviously, there's no equivalence. And then working out whether that corresponds with the amount of, reduction in phrenic motor neurons.
We did not do that, but that's a fantastic question because we've also looked at this in other muscle groups. So a lower limb muscle we've looked at, and we found similar reductions in motor neuron numbers and in the size or the somal surface area of those motor neurons. But we did not classify the severity of their spasticity. There really isn't at this point, there are people working on it now, but there isn't a classification system for looking at symptoms in animal models. But there are definitely a difference I can see in my mice based on essentially weight. Those of lower weight tended to be the mice with the most severe symptoms. And even based on weight, we didn't differentiate if there was greater loss in those mice.
Right. So many thoughts around that. What does this mean for... And I know that, we're understanding what we're seeing for mice and humans, right? There's always going to be that difference, but we're learning a lot from this research. So for clinicians working with people with cerebral palsy and we're trying to get them physically active, for example, are there things that we need to think about and be mindful of?
Absolutely. So a few of the things that I think about with this, and that it sort of leads me in the direction of thinking it's things that we do need to investigate further. But in seeing some of the things that my daughter is going through, as my daughter has cerebral palsy and difficulties that she has. So there's times where she'll be just standing and all of a sudden her muscles seem to stop working and she just falls out of the blue. There's nothing she trips over, nothing startles her. Her muscles just seem to shut off. And so is there something going on with the motor neuron where it's not able to sustain that sort of contraction or that activity, particularly when the brain's really not able to send the signal to it to do that?
Sure.
We also know that there's a lot going on with our adults with CP, with having more difficulty with fatigue, having difficulty sustaining their physical function like they used to when they were even teens. And so is there something with that motor neuron that's contributing to that fatigue and decreased function that folks are having with aging? Is there a sort of aging dropout that continues with those motor neurons that's impacting that function that goes beyond what we think about typically for CP and think about the brain itself? When it comes to therapies, it's still highly effective to do physical therapy, to have goals, to work on strengthening, to work on gait, to work on that motor function.
Sure.
But I think it's also realizing that there's a point where things may plateau, and it's not the fault of the individual. It's not that they're not working hard enough. It's also not the fault of their physical or physiotherapist. It just simply is. And so helping them to optimize their function and their endurance and activity within whatever their body is able to do.
Sure. That's really important, isn't it?
Absolutely.
I mean, you hear sometimes from a train effect, and people are expecting where they might get to and they feel disappointed when they can't get there. But there is an element there we can kind of just help them to understand there's a physiology based on this, and that's important. That's relieving. It kind of releases people to be aware of what their realms of possibility might be. And it's not to say you can't push for that, but there's we all have a limit.
Exactly.
We all have that limit. I am never going to be a sprinter. I think I run real fast, but if you saw a video of me, I'm really just a dawdler. But I'm very happy with my capacity.
Absolutely.
You know,
I've
there's
never
only
learned
so
to do a
much.
cartwheel. Like there
I
are just
cannot
things
Yes,
that
that's right. Yeah.
physically I just cannot do and will not ever be able to do.
Yeah.
Can I ask a question? And if I've misfollowed this, or then you don't have to tell me. You can tell me, as in I don't have to ask the question. So you mentioned if the motor neuron isn't used, then obviously some of them are unable to generate the pathways or kind of is that right? Yeah. So, noticing that those phrenic motor neurons, those in those weaker, smaller mice, they were less prevalent at, was it 28 days?
Yes.
Yeah. Is there any intervention that you could use to offer respiratory support that could increase that motor neuron use? I'm thinking from, and I know this is not appropriate, but from my old school spinal days, we would use like intermittent positive pressure breathing, things to kind of, and obviously you wouldn't be doing that in a mice, but you may, but things that you could do with the mice to, I guess, use these motor neurons.
So would specific physical activity essentially save or rescue motor neurons or help these motor neurons to grow and be more effective? That's probably along the line of the $1 million question, right? I don't know is the long and short of it. The other piece of it may be that it may not be entirely related to that physical activity piece. Because when you think about motor neurons, our most active motor neurons are the ones that are doing the endurance activity, particularly in the diaphragm.
Right.
That just baseline breathing that we're doing, we're utilizing those smaller motor neurons. We're not using the larger ones that we need for those sort of Valsalva maneuvers or that big, strong cough.
Yeah.
So from that standpoint, I'm not sure that changing that respiratory support would necessarily change the motor neurons themselves. There may be something even more of a basic science piece that needs to be sorted out with why do they have that greater dropout of motor neurons to begin with?
Yeah.
Is there something with the difference in neurotransmitter signaling that's causing those motor neurons to not be perhaps as resilient and not be able to grow in whatever milieu they're operating in that central nervous system?
Lots of questions. Amazing. So where does this take you now?
I need more help is where that takes me. So what I'm hoping is that by getting this out, that there will be people that are much smarter than me, people that have that curiosity and have more skills than I have to be able to also help get this to that next level of asking those next questions of, we're seeing this. How do we prevent it? How do we change it? Where is that area of opportunity to impact that? And how does that relate to human biology, human physiology, and how do we translate that?
Interesting. Yeah. A very great next step it's a call to action for people who are interested in this area, right?
Yeah. And getting people interested in this area because it's something we don't think about when we're talking about cerebral palsy simply because of the name.
That's right. You're absolutely right. And we had that conversation earlier with another guest just saying that, cerebral palsy is one of those things that sort of fits in everywhere and as a result doesn't actually have a home.
Correct.
Because, and as a result, that there's these really crucial areas that need to be put together for this overall picture of well-being, quality of life and everything that we want our young people as they age to have. So great questions. Thank you for asking those great questions.
I need help asking even more.
Oh, it's so fascinating.
Hopefully there'll be more people willing to do that.
Absolutely. Well, thank you. And I guess final plug, we'll see you at AACPDM in Philadelphia. And good luck for all the preparations for your turn in 2027.
Yes. And right now we're helping with that preparation for 2026. And in doing that helps me learn to be ready for 2027. We would love to see folks in Philadelphia in September, September 27th to the 30th.
Perfect.
It's a Sunday to Wednesday, so it's a little different than we usually have, which allows for some nice pre-conferences or pre-course conferences to get people in and get them started with the meeting. And some really exciting abstracts have been submitted, lots of courses that we're looking at, and they're currently finalizing the program. So stay tuned for more information for what will be planned for that meeting.
And it's going to be the 80th. It's a pretty huge milestone, isn't it?
It is a huge milestone with that. It's hard to believe that it's been 80 years for AACPDM.
Phenomenal. what commitment and what an incredible body there. So thank you so much for sharing that. Hope to see everyone there. Marissa, Philadelphia?
I won't be there, but I'll be listening to the podcast and I'll be cheering you on. And maybe the following year. Maybe.
That would be fantastic.
Maybe.
We would
Denver.
love to have
Let's
you.
do it. Let's do it. To all of our listeners, hope you enjoyed that. Again, our booth is still up. That is phenomenal. People are still packing. We can hear tape and rapping and everything's going on right now, but that is part of the fun. We'll talk to you all again soon. Another one to go.
Bye.
Bye.